Ooh, you okay there?
Yeah.
Caught you off guard?
No, it's just like also like I feel like I can feel a knot there.
Yeah, oh yeah, okay, definitely. Okay, if you need me to ease up, you let me know, okay?
No, it's good. It needs to go away.
Hi, Jamison.
Hi.
Good to see you.
Thanks for having me.
Jamison is now, I consider, we're becoming closer and closer friends, and she's also a regular patient at this point who's been coming in for almost like a wellness type perspective. She's got several complaints, several different body areas, but I'm just going to kind of let her talk about why it is she's coming in to see me. So as well as what she did this weekend. We had phenomenal weather, so I'm anticipating that she was more active. So let's go.
Yep. So for me, my back is always an area that gets sore and tired frequently. I struggle with posture working in like a very much a desk job, but I also am a runner and a cyclist, so a lot of kind of hunching over. And I find in between my shoulder blades, I get a lot of knots and it gets really tired, and then I do get quite stressed in my neck area.
So you mentioned desk job. What is it that you do again?
I'm an advisor with Sun Life.
Okay. So in insurance then, if that's the case.
Yeah, so I work with clients for their wealth needs as well as their insurance needs.
Okay, so that's definitely, that's textbook desk job. Okay,
Yeah.
very, very frequent. And then this weekend you mentioned that you were doing a lot of cycling then going on.
Yeah, so I did like an 8.5K run on the Saturday, and then I did a 30K cycle on the Sunday, which I had like a heavy pack on me, and so I really felt that yesterday.
Okay, so obviously this past weekend we had some really nice weather.
Yeah.
Okay, we had a lot of patients that were out and about for, it was like 30 degrees here in Canada, but at least in the GTA, excuse me, I don't know what it was like in other places, but so I saw a lot of increased activity after a long period of not that much activity because it gets really cold up here. So have you been keeping active consistently throughout the winter, or was it just kind of like, this is a great weekend, let's go out there and kick as much ass as we can? Like, how did that go?
I definitely stay active throughout the year, but I think throughout the week with such great weather, I did over 25K running and then a 30K cycle. I definitely felt that I was like, okay, this was a bit more than I normally do, and then I was getting like over 10,000, 15,000 steps a day just because it was so nice outside.
Yeah.
Any opportunity that like I could step away from my computer, I was outside.
So that actually happens quite frequently at the turn of any season here. We'll see a lot of people just start moving way too much, way too quick, and then they end up feeling sore, right? So very normal, it seems, thus far with Jamison here.
Yeah.
We'll get into a physical exam. Now we'll just double check everything that we've been doing, and then otherwise we will get into treatment probably pretty similar to what we've been doing in the past.
Great.
Okay? So to start, I'm going to get you to bring your chin down to your chest for me. Yeah, okay. Now I know you were mentioning that you usually get some neck stiffness, occasional headaches, but really kind of in this middle back region you're feeling this today, right? Now you bringing your head down like that, do you feel anything down here at all?
Yeah, definitely on the right-hand side,
right-hand
surprisingly.
side. Okay, yeah. So when I go ahead and I actually push down a little more, better, worse, or the same?
Like it's much more intense of a stretch.
Okay, let's come back up then. Now I'm going to get you to look up to the ceiling, please. Anything in the back here?
Not so much,
No?
actually.
Okay, I'm going to do a little bit of overpressure again. Anything?
Kind of, it feels like at the base.
The base
here.
of the neck
Yeah.
here. Okay, so Jamison's pointing to the CT junction, which you might be familiar with if you watch the channel, CT junction, where the neck becomes your upper back, cervical, thoracic. I'll get you to rotate your head this way. Check your blind. Up, that's a tilt. There we go.
Okay.
Just rotate. Perfect. All right. So we're getting about maybe 75 degrees on this side. I want to get you to rotate this way. And a little bit less on this side. I'd say maybe 65 degrees on this side. So a little bit 10% less on this side. Or 10 degrees, excuse me. Get you to tilt this ear to this shoulder. Good. Overpressure. Is that okay?
Yeah.
Now tilt this ear to this shoulder. Overpressure. That's okay? Okay, good. Awesome. All right. I'm going to get you to go face down.
Okay.
So you're saying you were feeling kind of in between your shoulder blades on the right side primarily, yeah?
The stretch happened, but when I was sore, it was yesterday, it was on my
left
which
side.
is surprising.
Interesting. Okay. There's no consistency with Jamison, it seems. So let's start with the left then. So anytime I hear somebody come in and say, yeah, I had pain between the shoulder blades, and it was only to one side. My first instinct is that it's going to be a rib complaint or a paraspinal muscle complaint. Again, the ribs are just to the side of our T-spine, and our paraspinal muscles, para meaning next to, spine meaning spine, are just next to the spine as well. So we're just feeling up, and it actually does feel a little bit knotted kind of in this region here. So that's a very common spot for a lot of desk workers, and actually just anybody in particular that ends up getting real tight. But okay. How's up here?
Not as tender as the spot, but
this is really okay. Because you
a
do
little
got tension
tight.
here,
Yeah.
but this feels to me like it would be uncomfortable. Okay, let's examine that right side.
Not as sensitive, but still pretty sensitive.
A little something, okay.
Ooh, there, something.
Ooh, up here. Are you right or left-handed, Jamison?
I am left-handed,
You're
but
left-handed.
I do all my sports with my right.
Got it, okay. Not the first person I've heard tell me that.
Yeah.
So. Okay, and of course we got the tight upper traps again as well. Okay. Oop, we had a little release there. And I'm also going to feel in your low back while we're here, okay? Now, you said you were feeling okay down here. It hasn't been bothering you, but we're just going to be checking in. Got a little bit of tension kind of in this region here. Mm-hmm. TL junction, again, channel, thoracolumbar junction, another transition zone like the CT, so very common we get tension in here for people.
I think it's always just like in comparison to my upper back, it's not as bad, so I don't think about it as
No, that's usually the case. A lot of people don't know just how tight or sore they are until I come along and go like, hey, what's that? And then they're like, how? So.
Yeah.
Okay, now SI joints, your sacrum is the bottom of your spine, your ilium, your hip bones, SI joints between them, okay? Left, right. A little bit on right side, and a little on left, a little bit more on right though. Okay, nothing bad. Okay, I will get you on your back. Okay, so Jamison's got some tightness in her usual spots, which is going to be the very top right side over here, a little bit down, and her left towards the base more so, but less up top. And once again, that's usual for most people, is that they'll have contralateral stiffness in two separate locations. So.
That spot.
That's the there we go. Now, as always, if I am going too hard, you let me know, I'll back off, but I'm trying to do a job, so. I can feel your muscle twitching under my finger. Can you feel that?
Yeah.
Yeah. So I'm going to get you to turn your head all the way to the right for me, and then just relax. you the old 1-2 for the top there.
I feel like it takes me that second to relax.
Yeah. It's okay, we got it. Okay, relax. I still got some on that right side. We did get the very top. That was an occiput adjustment, which is the top.
Okay.
So we'll try a little bit lower down. And you just breathe. Turn your head to the left. Drop, drop, drop. Relax as best you can. There we go. Right side feels much better after that.
Okay.
Good. Okay. Now I'm going to bring the mic around
Those are loud.
to the other side. Yeah. Okay, good.
Yeah, there's something there.
Yeah, at the base here. Ooh. Right, turn your head to the right. Relax. Drop, drop. Oh, that's okay. Yeah, that's a lot of muscle tension we actually have on the bottom left there, but we managed to break through just a bit. What a poor choice of words, break through. Yeah, that's awful. That's on camera now, we're keeping that in, so.
That's a good stretch.
You like the long axis
Yeah.
distraction, huh? Every single patient I have likes long axis distraction, and actually this is so universally loved that it can be no, I'm dead serious, that it can be considered a very concerning test if someone reports pain on it.
Interesting.
Yeah,
I can see
like
that.
the only time somebody thinks that this hurts is either acute muscle strain, which is fine, but unless somebody just recently hurt themselves, it can actually be an indicator for cancers or meningitis.
Oh,
Fun
shit.
fact. But hey, for you, it feels good, right?
Yeah,
good
that's a
news.
good
You do not
stretch.
have any kind of cancers or meningitis going on up here.
That's
So, yeah.
It just like relieves all the pressure.
Oh, yeah. Also makes you taller. No, it doesn't make you taller.
Gosh.
All right. Just realized the batteries on my mic are very low, so I hope that they hang in there. Breath in and all the way out. There we go. Good. Take a breath in and all the way out. That was a crunchy one. No. All right, I will get you to take a big breath in and hold it. Big breath in, hold. Okay, breathe out. Okay, what we need to do is just kind of twist you a little bit more. So like that, and we're going to bring this leg straight up. That leg's going to stay straight and hips towards me. Please. Thank you. Get good. All right, and good. So breath in, please. And all the way out. Nice. Breath in and all the way out. Really? Hips towards me, please. Thank you. Breath in. And all the way out. Good. Awesome. All right. Those were, though there were many there. Yeah. All right. So, if you're familiar with the channel at this point, you'd be very familiar with one of my favorite methods of treatment, which is the instrument-assisted soft tissue therapy. Very effective at immediately restoring range of motion and relieving tight muscles. So, yeah, we got a lot right in there. Can you feel the difference between here, for example, and here, Jamison? Yeah.
Big time.
Yeah. Ooh, you okay there?
Yeah.
Caught you off guard?
No, it's just like also like I feel like I can feel a knot there.
Yeah. Oh, yeah. Okay, definitely. Okay, if you need me to ease up, you let me know, okay?
No, it's good. It needs to go away.
So anytime we have an acute knot, we're getting in there trying to work it. Very common that we will get hypersensitivity like that. And you can't see it, but she's kicking her feet down there trying real hard to put on her brave face. So, again, emphasis on if you need a break, you let me know, okay? But I am trying to make an omelet here.
Yeah, it's like all so sensitive there.
Oh my goodness. Even as we get lowered down,
So I wonder if it's always where like a sports bra or a bra sits.
Depending on the sports bra or bra. Yep. I wouldn't know from personal experience, but not as bad down here?
No, right there is like
Right
just
in
as
that
bad.
spot. Okay. It's calming down. So we got quite a bit of redness coming up here, okay,
That's
which tells
okay.
me that, yeah, definitely sensitive. I need a little bit more of this. Okay, so, wow. She's really settled down after just even that. Like, she's not kicking her feet anymore, which is a good sign. But I'm just blocking this with my hand, aren't I? There we go. Do you feel like that's easier, Jamison?
Yeah, so much so.
So-
like even more so. Massage has never calmed down the muscle.
look
as
at-
much
look
as
at
that
that.
has.
All right, so we'll take that as more proof that this is a pretty effective method and definitely why it's my preferred. Awesome. Still got a little bit left there. Okay. We'll just do a little bit more here and then call it. I don't want to go too much. Yeah. Okay, good. Mm-hmm. That feels like a rope, but less so than it did before. So that's my good news for you. You remember this, and you just look up and to the right, and take this pointy elbow, and a little pressure there, and down to the left, okay? And to the left, good. So sorry, I think I'm pulling your hair a little bit there. Let's get that out of the way. Up and to the right, and down to the left. Up and to right, down and to left. Up and to right. Down to left, up and to right, and down to left. Okay, now tilt to the right, and tilt left, tilt right, tilt left, tilt right, tilt left. So Jamison, my advice to you is to continue to be active, but do it regularly.
Yeah.
So that you don't just get slammed like you kind of do, because you were quite tender during that sports massage, but that's okay. It's nothing that won't resolve. Go a little bit of TLC in time, okay? And rotate your head. Excuse me. One more. Yeah, there we go. And oof. Good.
I think it was not being used to carrying such a heavy pack.
That would probably help. Less beers.
Yeah.
Alright. Okay. Up and to the left. That would be the right. There you go. And down to the right. Good. Up and to the left. Down and to the right. Up and to the left. Down and to the right. Up and to the left. Down and to the right. Left, down to the right. Good. You can tilt to the left. Good. And tilt right. And tilt left. Tilt right. Tilt left. Tilt right.
Something's there.
Yeah. Tilt left. Tilt right. One more left. And right. There we go. Good. Shrug for me. Shrug up. Like, no, just hold it. Good. Now I want you to just slowly lower it down. Slowly lower the shrug. Good. Shrug up. Slowly lower down. And one more shrug up. And slowly lower down. Shake it all out. Good. Awesome. Okay. All right. So, how was all of that?
So I just said I really needed your elbow, like, in my neck.
Okay. So you feel pretty better almost significant almost immediately after that.
For sure.
Yeah.
So I don't think there's anything you can do like that's quite the same. It's just
having somebody with a pointy ass elbow, like literally, you can get like a wicked angle on that. I don't know what that olecranon process. Okay, so Jamison really found the MRT component of the treatment effective for her neck, and I know that because again, I've been working with her for a few weeks, maybe almost a couple months now. And that's just what her body responds best to. Again, every body responds differently to every treatment available, so that's why it's important to identify what works best for the patient and use that. You can't just do one technique for everybody and expect to get the same effect across the board. And then also the instrument-assisted soft tissue therapy, or the sports massage. How is that?
Yeah, I've never been able to take like that pressure that long for that spot. It's just been an ongoing issue for me. I've done like a lot of massage for it,
like traditional hands-on massage.
Yeah, and it's just never been able to I've not been able to withstand it, or it's just not the pressure that I need. And I was really surprised how quickly the muscles, the muscles started to actually relax, and then you're able to actually really get in there.
You still had a little bit remaining at the end, a little bit of that sensitivity, but especially compared to when I initially put the tools on Jamison there was a significant decrease in the sensitivity, which is what we're looking for, right? Now, the sports massage specifically is really good at treating the fascial structures. And I don't know if I've explained fascia to you, but it's this saran wrap-like layer that encapsulates basically every soft tissue within our body. And the fact that we were able to get in there and really calm things down tells me that it's more of a fascial component rather than a strictly muscular component, which massage would usually treat pretty well, right? Or a joint one, which a chiro traditional adjustment would treat as well. So happy we found that seems to work for you. It's probably something we should incorporate going forward for the treatments.
I would say so.
But do you have any other closing thoughts or anything at all, or before we sign off for today? Thank you for coming in, too.
Happy to. No, happy to help. No, that's exactly what I needed, as I said, after like a really active weekend and getting like back into summer where I think we all get a little bit more active, hopefully. I needed that.
All right. Awesome. Well, thank you again. And always really bad at any of these things, so how about just a fist bump there? Boom.